Hello. I am getting ready to have a conversation that you don't want to miss. I'm going to speak to Dr. Adam Hamawy and Dr. Uh, Murr, who I just met, who are both from New Jersey, but who are in the West Bank right now, delivering medical services, very important medical services to Palestinian families who are in need. And so I want to invite them in to this discussion, and I want us to talk about what's happening, what shouldn't happen, and what we pray will happen in the future. So, Dr. Hamaway and Dr. Mirth, thank you guys for being with me today. I originally thought I was going to talk to you. I just thought, Dr. Hamawy, that you were in Gaza because you were there so much. Thought there's going to be an opportunity to talk from there and talk about the devastation of the physical infrastructure and the kind of patients you had to see there because of what's happening, and even in a so-called ceasefire. But you were in the West Bank. And that's not something we talk about enough, because the West Bank is a home to many Palestinians, and their homeland there is being is very vulnerable, is being treated as if it belongs to someone else, and we obviously the Israelis, and those families are suffering. And so you and Dr. Taha Moore are from New Jersey, over there in the West Bank. I want people to know what kind of services you're delivering. So do me a favor, Doc. Both of you tell us the kind of medicine that you practice.
Please go ahead.
Okay. So I'm a plastic surgeon. I do plastic and reconstructive surgery. I'm based out of Princeton, New Jersey. I work both in Princeton and in New Brunswick. And, I provide, reconstructive services, usually when I'm overseas. And what we do is take care of, as a plastic surgeon, wounds that occur from trauma, or wounds that can occur from regular diseases like, cancer, which is why we're together on this trip, and also with congenital abnormalities. So we have a pretty broad practice, as plastic surgeons in general. So I try to spend my time when I'm in Gaza. I'm usually taking care of the devastation that's caused by the genocide there with bombs and bullets. And when I'm in the West Bank, we're trying to take care of routine care that we see that in the United States that's available to us. And even here in Israel, just 15 minutes away, you have one of the best healthcare systems in the world. But in the West Bank, it's not available.
Thank you, Doctor. Dr. Moore?
So I'm Tahamur. I am an ENT by training, and I am further trained in head and neck surgical oncology. And so my role in the healthcare world is taking out big tumors, reconstructing them, and taking care of challenging cases. Like Dr. Hamawy had mentioned, we'd come to the West Bank to take care of challenging cases here, patients who may not be able to get the care that they need due to several issues that we'll discuss during this call.
I was struck by a conversation with you earlier about the fact that these are the things that you all do on a routine basis in this country and in our great state, New Jersey. But they're so life-saving and so important in the West Bank because their healthcare system is nowhere near what it needs to be. So first of all, let me just tell you, I'm grateful for the work that you're doing and for the willingness to be there. And I want to talk about the West Bank a little bit because I don't think that we talk about it enough. I have visited the West Bank when I have been in, when I've taken trips to Israel, and then, we get to go beyond. I'm struck because in Gaza, we saw the physical devastation of infrastructure. We could look at it and we could see it. In the West Bank, we know it's a different kind of dismantling of the infrastructure. It's taking away the homes and the communities of Palestinians who lived there and who worked from there, who gardened from there, who were peacefully existing there, and just going in and taking over those areas and then creating these perimeters of safety and security for people who aren't Palestinian. And so I wanted to ask you, before we got into some other stuff, where do these people go? You know, in Gaza, we know people can't find hardly any kind of shelter. Where are the people in the West Bank going? And where are they living now that they don't have their homes?
Yeah, that's a great question. These, like you mentioned, a lot of people end up getting displaced due to some violence or, fear for their lives. There have been lots of reports in the last year where whole towns have been displaced. And it becomes pretty challenging for them. These are generally people who are underserved, underprivileged, and don't really have support around them. They end up, we were talking to a physician earlier today, a local doctor, who mentioned that these people will find, pick up tents in random areas or will literally live under a tree.
Mm-hmm. Can you tell me about the medical services that are there? You mentioned very briefly some doctors get to work 2 days a week. Is that what you said?
Yeah.
And why is that, Dr. Hamawy?
So basically, the way the system is set up in the West Bank is that the Palestinian Authority collects, taxes for the Israeli government, and the Israeli government is supposed to return that revenue that's generated by the taxes to the authorities so that they could fund the hospitals and fund the healthcare system. But since 2023, that hasn't been happening. They've received really no revenue at all. So most of the doctors haven't been able to get their full pay since the beginning of this, of everything that's happening in the last couple of years. So the way they're rationing out care is basically the doctors are only able to work 2 days a week because they could only pay them that much. And so they're basically working on, 30 or 40% of their salary. And this has affected, the access to care for most of the Palestinians. Again, many of them are just refugees living in tents or out in the open. And then many people also just don't have the means because there's no jobs now. They can't leave the West Bank. They're basically trapped in here just like a prison. And, they don't have the money because they don't have the income. The government doesn't have the money because they're not getting the revenue. And so it's this vicious cycle. And even in terms of training, many of the physicians here just don't have the advanced training required to provide some of this care. In the past, they used to be, triaged into Israel to get like their tertiary care, like the advanced cancers, or if they needed chemotherapy or so forth. But now they can't even do that, and they can't leave the country and go to Jordan or to Egypt or to anywhere in the world because they don't have the money to do that either. And so you have like something that we would normally see, diagnose, and take care of early, and now they're just either like dying of these cancers, or they're like so advanced. These are things that we just don't usually see, like because it's just not something that like modern day healthcare allows to happen.
How many hospitals do they have there on the West Bank that you have access to, or that doctors have access to, or any kind of medical facilities? Like where are you functioning out of? You don't have to give me the name, but is that a hospital?
So yeah, they actually have quite a few hospitals. They're just understaffed and underfunded. The town that we were in, I think, had 5 hospitals. I think like 3 government hospitals and 2 private hospitals. I might be off, but there are hospitals here, and some of the facilities that we saw were actually pretty good. They just didn't have. People didn't even know. Some people didn't know how to use them. I mean, you could talk about like some of the devices that were just sitting there.
Yeah. I mean, there's a very routine instrument I use, a device, a nerve monitor for a lot of my surgeries, for a lot of the head and neck surgeries, thyroid surgery, parotid surgery. They're just simple leads. And apparently it had been sitting in a storage unit for a couple of years. No one knew it existed. No one knew how it worked. They didn't even have the right instruments for it. So things that are very routine that we use, in the States all the time, physicians just don't have the training to use them and don't really understand how to use them.
So let me ask you this. Are the doctors who are there, are they given the opportunity to work with you? And so that they could see the using these techniques and these instruments that are not new to you, but are obviously new to them. Do they get a chance to like shadow you? You get a chance to tutor them and prepare them?
Absolutely, yeah. Prior to us coming, we sent the word out that we were coming, and we had surgeons come from all over the West Bank, from as far down as Ramallah, Tul Kerim, Nablus, and they all sort of came to join us and watch us. They did watch us do a lot of complex surgeries, and I did have that opportunity to teach them how to use the nerve monitor. It's a very straightforward, easy machine to use, and I'm hoping that they'll be able to utilize it in the future.
Yeah.
What kind of patient? I'm sorry, Doc. Go ahead.
Every surgery that we did, we had Palestinian residents, attending surgeons scrubbed in with us and assisting us, because again, they also want to learn. It's not like they don't want to do this.
Right.
They haven't had the opportunity to see this and take care of it and work with specialists. And then we had students in the room as well. So we had students, medical students in the back observing, and we gave a talk at the medical school. One of the main, I guess, goals of these trips that we do here is education, because that's the ultimate, we want them to be able to take care of themselves. And, we tend to shackle them by not giving them the education and their basic, like fundamental, like grade school, college, they're very well educated, but like when it gets to the medical specialties, they just didn't have the opportunities. Mm-hmm. So it's funding and learning, and then they could take care of themselves.
So I'm going to ask you two questions in one. One is, give me some idea of the kind of surgeries that you two are doing. And number two, are you allowed to bring helpful supplies and instruments? And if so, I know you would be leaving them, but do they allow you to bring them in and leave them?
So as opposed to Gaza, where in Gaza we can't do this, here we could. So we both came with instrument sets and equipment and sutures. And so we were actually pretty well supplied to be able to provide the care that we needed. And that was also, based on the planning that we did ahead of time. Like Dr. Moore was saying, we were talking to them beforehand. We had a basic idea of the surgeries that we were performing, and we prepared for them. And actually, the set that I came with, the instrument set, I actually left it there for them. And, one of the things that, they need is like some of the sets that are there are old, and, they get worn out over time. It's like they've had sets they said they've been using for 15 years. And so you get instruments that are missing, some are inappropriate, some are just kind of worn out. And then there's things that they just didn't know. Like there's this instrument that we could kind of use to retract or to perform the surgery. So yes, we do bring our supplies here and we leave them often. Like we ended up using some equipment from a team that left it before us. And so, we kind of hand off care from one team to the other, even different organizations. One of the patients that we could talk about, had a biopsy by a prior team, and it turned out to be cancer. And so when we arrived, we were able to, take care of that. And we didn't have the equipment that with us because we hadn't planned for it, but they had left that equipment for us. And so it's a team effort. It isn't just us. It's just really all the doctors and healthcare workers that have been coming here for years, really, not just, in the last 2 years. This has been going on for decades, and trying to provide the care.
Why did the light go off behind you?
I don't know. We'll see if we could turn it on and just kind of
turn the light. No, I'm okay if you're okay. I was just curious.
Yeah,
turn the electricity off, and I wanted to know because that's one of the things you hear that's happening. You know.
They just randomly go off sometimes, but we'll see if we could get a turn on. I think we're okay, right? As long as
But
you could
yeah,
see
we're
us.
good. I see you. You look good.
It's probably better if you don't see us too well. So.
I know that you're really concerned about 2023 seems to be a real big moment where you see things escalating to the negative in the West Bank. I mean, I think I have information about harvest areas being destroyed, olives areas being destroyed, and things of that nature. But you were concerned because you were saying that 100 to 200 and some people had been attacked, or between people and the land that they live off of. I just need to know what you're feeling, Doc, about the West Bank and the people that are having to live there.
So this is, this has been going on for decades, but on October 7th happened. It basically gave an excuse to really clamp down, not just on Gaza, but here as well. And so even though, the excuse always is that, we're attacking Gaza because we want to get rid of Hamas. Well, there's no Hamas in the West Bank. There hasn't been any since, for the last 20 years. And yet the violence here, the settler violence has increased, and over 1,000 people have been killed. Hundreds of homes have been demolished. Again, hundreds of families have been displaced. You talk about the olive gardens and the olive groves this year, like just this summer, and back to only just a couple of weeks ago was the harvest season. And the settlers were basically attacking and burning the olive groves down, and attacking the people who were, harvesting them. Like, I mean, there was a trauma just recently in the news, and the hospital that we were at, they were saying, just be aware, our surgeries could be canceled at any time because these are constantly coming in, and we have to take care of them. So it's just increased, and every month is worse than the month before, and every year is worse than the year before. And I think, unfortunately, with the genocide that's been happening, it's given an excuse to increase the pressure on the West Bank, and people just haven't been paying attention. If Gaza hadn't been happening, and it's such a horrible thing, what's just happening in the West Bank alone is enough to kind of bring attention to it, and and it's just horrible. But it's just overshadowed by the horror that's going on.
Yeah.
Just on the other side.
It's like within the last year or so, 1,500 people have been displaced, and they're displaced into the camps with maybe some tents and maybe not.
Yeah, they're in refugee camps. I mean, there's just only limited land, and they get it pushed into smaller and smaller areas.
My heart aches for children, as well as for everybody, and especially the elderly and the children, they're most vulnerable. Are you seeing a lot of children and elderly people coming into the hospital while you're there?
That's basically who we took care of.
Yeah, we almost took care of exclusively elderly patients and children. The elderly patients.
God bless you.
Yeah, elderly patients end up having very advanced, tumors, masses, or complications from prior surgeries, and the children end up having congenital issues like cleft palates and big facial lesions and masses that they were born with. So we took we had the opportunity to take care of the full spectrum of patients.
I know you all must be really very busy trying to do as many of them as you can, serving their needs as much as you can while you're there. How many other of your colleagues are with you? Is it just the two of you today?
So with our specific team, it's the two of us, and then we had an anesthesiologist with us as well.
Well, that's good.
Yeah, so we got lucky. That makes us a little bit more efficient.
Yeah.
And then we had a hand surgeon with us as well.
That's right.
I talked to you so much about your work in Gaza, and I want an opportunity whenever you go there to have a conversation from there. Dr. Ter, have you been to Gaza?
I have not. I've applied a couple of times, but I've just never been able to get approval to get in.
Well, what's blocking your approval?
It's never really been completely confirmed, but I am a Palestinian citizen and a U.S. citizen. And so, since the October, 2023, no individual with a Palestinian ID has really been able to get into Gaza to provide support and relief, regardless of, their other citizenships, including, U.S. citizenship.
Dr. Mer, who is responsible for denying you or approving you're going into Gaza?
All approvals in and out of the West Bank, Gaza, and Israel is generally through the Israeli government.
Well, I don't want to make anybody any madder by saying something that would stop them from at least letting you come into the West Bank. But the notion that any American or any healthcare relief that would be willing to come into Gaza should be encouraged, not put through hoops and not denied. I've never seen anything like that in my life. And we've got to stand tall. People like me who are in legislative positions need to stand behind you all. I am so grateful for the work that you do. I have tremendous respect for Doc, and I have a new person to have a respect for. I want to be a resource for you. I just need you to tell me when you want to talk, when you want to show up, when you want me to do something, and I will be delighted to try to help you. You're doing God's work. I think my purpose in being a legislator has to do with doing God's work. And so I want you to be safe. I want you to know that you're appreciated. I want a gazillion people to see this. I want them to see the inhumane behavior and actions and outcomes of what's happening in both the West Bank and in Gaza. And I want them to find their humanity. And I want to start with the President of the United States of America. And so, thank you. You want to say anything else in closing? I've held you for almost 30 minutes.
Yeah, I mean, first off, I want to say we appreciate your eagerness to help. We appreciate all your efforts and, shining light, on the West Bank. I've seen all the great work you've done in regards to Gaza, and I'm glad you're also shining a light now on the West Bank. Things have escalated quite a bit here. And these people, these patients, these human beings need help, they need support, and they need the care. And so I thank you for everything you've done.
Thank you.
Yeah, Congresswoman, as always, I mean, your courage in speaking out and doing God's work, like you say, has, it been inspiring to all of us who've been watching you do this, and you've been fearless. And, what I would, like is to people to see what's going on. I mean, we are really trying to take care of our fellow human beings here. And if anything that we could learn is that, we are all better when we just take care of each other. And it's sad to see that only 15 minutes away, one of the best healthcare systems in the world exists, which we should use as a model in the United States. I mean, the one good thing I can say about Israel is they have an excellent healthcare system. Unfortunately, it's not accessible to people who are, like I said, like a 20-minute drive away. And if we could kind of just fix that and take care of everybody here and in the U.S., then we should do our best to do so. And there's no reason not to. I mean, this is not a security issue or a threat. These are sick people. And
so I'm going to say to you that you speak about courage, and I admire yours. Mine is a fraction of yours. And then I want to end with something I think, unfortunately, is a little snarky. For Israel to have such an amazing healthcare system, it needs to work on its mental health care system. at the very top of their leadership. And then perhaps we could all find together our humanity. So God bless you. Be safe. Take care. And maybe I can meet you when you're both back in the States.
Thank you
Thank
very
you.
much.
Thank you.
Take care.
Take care.
Bye-bye.
Bye.